Just to give you an overview regarding the psychopathology or the underlying formation of the somatoform disorders, just to know these disorders in a better way, it's again very important. Why is the history taking so important when you have the somatoform disorders at your hand? Because the pathology lies in the history. Usually, the patient will give you a history of a childhood abuse or of some sort of physical abuse in the past or some sort of a stressor that is present in the recent past, and that is why that particular patient is presenting in that particular form of a conversion or a dissociative disorder or a hypochondriacal disorder. Sometimes on a detailed history or history that is taken from the collateral side, you'll get to know that the patient, one of the close relatives of the patient is suffering from a serious illness. So that is basically making the patient more cautious that he or she can also develop that particular illness. For example, it can be cancer or HIV or Hep B, C that he or she may be thinking that he may be suffering from. So all of these are the psychopathologies that the patient can have, and that is going to change the thought form and the thought content of that particular patient. Those delusions of paranoia are basically due to that particular fact that he had in his past or in her past. So just to get a better understanding of the somatoform disorders, one should know what is the etiology of these somatoform disorders and what are the different diagnostic approaches towards making a correct diagnosis in these particular patients. Now, the practical approaches towards a mental disorder, one should basically go through that organic, medical, or the substance versus the non-organic disorders. So one should know how to differentiate an organic disorder from a non-organic disorder. Again, the laboratory investigations will make the mainstay over here or would lay the foundation towards the differentiation between these two categories over here. Then we have the psychotic versus the non-psychotic symptoms. Usually the psychotic symptoms would be affected by the counseling sessions, by the behavioral therapies that are usually carried out in such patients. If the psychotic with or without the affective symptoms, they are found in such a patient. For example, the affective symptoms, basically we mean the mood affective disorders that the patient can be suffering from, and one should know how to differentiate these disorders. Affective with or without the psychotic symptoms, so this can be one of the disorders. Then we can have the severe mental disorders versus the soft psychiatry. Soft psychiatry is basically, it can be just the personality disorders that are seen in the individual. Some people are from the type A personality, the others from the type B, then others from the type C personalities. And depending upon their personalities, there are these particular traits that are found in these individuals. So that is basically the soft psychiatry that one should know how to deal with the psychiatry of such people or such patients. Now, just a brief look at the etiology in these cases. The models of psychopathology is again very important. Then the biological factors are again very important, and they play a pivotal role in the development of the different somatoform disorders. Then we have the psychodynamic factors. They're again very important. The cognitive factors are again very important. The thinking process, the thought form, the thought content of the individual is again very important. Just by the counseling sessions, just by getting a detailed history, one would get an idea about the thought frame of that particular person that we are dealing with. The learning disabilities are again very important, and they can basically provoke such conversion or dissociative symptoms in a patient. Humanistic approaches and humanistic factors are very important. The diathesis or the stress factors are again, they play a pivotal role in the development of the somatoform disorders in these people. So when we have a look at the categorical classification towards the dimensional classification of the diseases or any psychopathologies, does a person have blood pressure or no? This is basically a categorical classification. You categorize, if the person has a high blood pressure, you categorize him in one of the categories, that can be a type A category. And if he doesn't have high blood pressure, you categorize him or her in the second category. So basically you have two categories in the categorical classification. classification. On the other hand, you have a dimensional classification in which you have the threshold for the diagnosis of the hypertension. So usually there is a continuum of the Marmont. Usually you define these people as suffering from or having a mild, a moderate, or a severe form of disease. Even you have a subclassification for this mild, moderate, and severe terminologies. So this is the difference between the categorical classification and on the other hand, you have a dimensional classification of these psychopathologies that you're dealing with. Categorical classification is basically the presence or absence of the disorder. Either you are anxious or you're not anxious. So this is the categorical classification. DSM-4 criteria is the categorical classification of the psychopathologies. And then we have the dimensional classification on the other hand, the rank on a continuous quantitative dimension. So usually you have a range of readings that you have in the dimensional classification and how anxious you are. You have a scale over there and you're going to grade that person from 1 to 10 how anxious he or she is. So usually this is known as the dimensional classification of the psychopathologies. Then we have the diagnostic approaches. They determine the specific primary disorders. It can be the multiple diagnoses. Sometimes we have the hierarchies of the psychopathologies, in which you have again the mild, moderate, and severe forms of the disorders not better accounted for. So the diagnostic approaches are usually not better accounted for, and usually we follow the conventional methods of the ranging disorders from the mild, moderate, or severe form. Either you are suffering from a particular kind of illness or not. Rule out the disorder due to the general medical condition, for example, due to the hypothyroidism in a lot of cases. Rule out the disorder due to the direct effect of a substance. For example, the substance misuse can include the alcohol misuse. Then we have the reserpine-induced psychopathology. So all of these disorders can be put forth in the diagnostic approaches of the individuals. So if we have a look at the other factors, the distinguishing adjustment disorders from not otherwise specified. So NOS is basically an abbreviation for not otherwise specified disorders in this category. And then we have the establishing the boundaries with no mental disorders. So again, you have to basically classify this person as if he's suffering from a mental disorder or not. So the psychopathologies can be classified in this way as well. Then we can add a lot of subtypes and specifiers, for example, the severity of the disease, in which we have the ranges of the mild, moderate, and the severe forms. The treatment-relevant diseases, some of the diseases can be treated with the psychopathologies. Some have to be coupled. In a lot of cases, we have to couple the psychopathologies in which we have to basically inculcate the cognitive behavioral therapies along with the medical interventions. And then we have the longitudinal course therapies that can be devised in a lot of cases. So over here in this section, we specifically focused on the different approaches towards the psychopathologies of the somatoform disorders. It can be the dimensional approaches. We can also basically categorize these diseases upon the severity of the disease, as one can suffer from the mild, moderate, or the severe ranges of the somatoform disorders. So that is the end of the section. Thank you for watching sqadia.com.